Welcome to Chapter 1 in Nursing Research, which is integrating the processes of research and evidence-based practice. In this chapter, we're going to learn about the processes of research and the process of evidence-based practice and how they are similar and how they are different. You might be asking yourself, why do we do research at all? As the slide says, is to provide a foundation for nursing practice that optimizes the delivery of quality bio-psycho-social interventions. What it means is that the ultimate goal of nursing research is the generation of knowledge to guide practice. One of the ways to accomplish this is through guidelines, protocols, and policies related to nursing interventions developed from the collective outcomes of research findings. This is known as evidence-based practice. Evidence-based practice, as you might well know, provides an understanding of that health-illness experience from the perspective of the individual, their family, or the community. It also helps in the implementation of interventions that promote patient health and provides quality, cost-effective care within a healthcare system. Now, as I alluded to in the beginning, we want to look at what is the difference between research and evidence-based practice. Research is systematic, it's rigorous, logical, and an investigation that aims to answer questions about nursing phenomena. Evidence-based practice is the collection, interpretation, and integration of valid research evidence combined with your clinical expertise and an understanding of patient and family values and their preferences to inform your clinical decision-making. Well, when you first read these definitions, they may seem very similar since they both begin with a question. However, research is a study that tests a question with a specific design, which means you may ask the question, what is the best yellow gown to take care of patients with MRSA? And if you went to the literature and you didn't find anything, then you would have to start a research study. Whereas evidence-based practice appraises the literature for already completed studies to find the best evidence to change practice. So, as a nurse, you need to be a knowledgeable consumer, which means you use critical appraisal, which you're going to learn how to do in this course, to evaluate research evidence and compare them to existing standards in order to implement them into practice and improve your clinical nursing interventions. And you're going to be doing this as a nurse in any organization for which you work, such as right up the street, Advocate Christ Hospital actually has nurses doing research in order for them to maintain magnet status. What this means is that you should be able to read the research literature and decide what is good and decide what is trash so that your patients will not suffer. Now, there are several types of nursing research, but in this course we're only going to be looking at basically two. One is qualitative, the other is quantitative. Qualitative research seeks to understand the meaning of human experience, such as, what is it like to be a widow? What is it like to be a nursing student at St. Xavier University? And what does it feel like to have AIDS? These research studies are usually conducted in natural settings, meaning that if I wanted to find out what it was like to be a nursing student, then I would come to St. Xavier, maybe sit in your class, and then interview you afterward, or go down to the cafeteria and talk with you there. Qualitative research seeks to describe experiences so that you as a nurse come to your patient with a deeper understanding of their problems. It is a very subjective approach and is used many times to generate theory. Quantitative research, on the other hand, seeks to test relationships or answer a question, such as my question before was, what is the best yellow gown to take care of patients with MRSA? It explains cause and effect relationships and seeks to describe and predict phenomena. Objectivity is very important in this type of research, and it is used generally to test theory. Types of journal articles. Now, there are several types of journal articles. Ones that we're going to be interested in looking at in this course are research articles, which can be qualitative, quantitative, or mixed, and they are generally just one study. Whereas meta-analysis, that type of journal article uses statistical methods to analyze combined data from multiple studies, which means it takes the data from selected experimental studies, combines all that data, and then does a statistical analysis of it. Whereas systematic or integrative reviews, they only summarize the findings from multiple studies on a particular subject. There are also a couple of other types of articles. One is a metasynthesis, which uses qualitative methods to analyze combined data from multiple qualitative studies. And then there are clinical guidelines, and those are statements designed to guide clinical decisions in specific situations. They're kind of like the policies and procedures that you'll find in your clinical institutions. There are levels of evidence in our research, and you should have heard about those probably in your concepts class, but we'll review them again. Level 1 is the meta-analysis or systematic review of randomized clinical trials or experimental studies. It's the top of the heap. And if you're going to want to change practice, you should probably get this type of evidence if it's available to you. Level 2 are single randomized clinical trials or experimental studies, and we're going to learn about those in this class. Level 3 are quasi-experimental studies, which we're also going to learn about in this class. Level 4 are non-experimental studies, whereas Level 5 are case reports, program evaluations, and qualitative research. Finally, Level 6 is single descriptive or qualitative studies, whereas Level 7 is just the opinion of respected authorities. You should always use the highest level of evidence that you can find before you initiate and change practice. So how do you evaluate the strength of research evidence? One is quality, which is the extent to which a study's design, implementation, and analysis minimizes bias. And we're going to discuss this an awful lot in this course. Quantity is the number of studies that have been evaluated in the research question, including overall sample size across studies, as well as the strength of the findings from data analysis. And the more studies that you can find, the better off for you to be able to justify a change in practice. You also need to evaluate the consistency of the research evidence. And the consistency is the degree to which studies that have similar and different designs but are investigating the same research question report similar findings. Remember that one study does not evidence-based practice make. So, in the evidence-based practice process, the first thing you do is ask a question, such as, what is the best yellow gown to use while caring for a patient with MRSA? Then you gather the evidence, which means you go to the library and look in the databases to see if there have been studies done on this. Then you appraise and assess that research to see if it's good, sound research. And finally, you act on it, which means you purchase those particular yellow gowns, you put them on the floor, you have the nurses use them, and then at the end process is you evaluate to see, does this particular type of gown actually lessen the impact of MRSA on your unit? Now, many people think that they know how to find a research article, and through the years I have found that students generally have a hard time doing this. So when you pull up an article, you're going to want to look to see if it has an abstract, and that's usually everything has an abstract. But in the research article, you should have some research purpose or question, or a description of the objective or the aim of the research. It also should include a literature review, which is what is known and what is not known about the particular subject. In our case, it's yellow gowns. Then there should be a section titled Methods or Research Design. That usually includes the sample, which is who are the people that were involved in the study, and the reliability and validity of instruments. And instruments in this case are generally the questionnaires that were used in the study. Finally, there are procedures used to collect the data, and then they should have a section called Results, which is usually all the statistics that I'm quite sure that you as students hopped over, because who wants to read that stuff anyway, because I know that before I became a researcher, I did that. Then there should be a discussion, which usually includes comparisons with similar studies. It should talk about the limitations of this study and any new or unexpected findings. And there should be a section that includes recommendations for practice and implications for new research. And finally, there should be a whole list of references. Now, when you come to class, I'm going to have a reference librarian come in to try to give you some tips on how to find a research article. And I will see you in a while.